What is the out-of-pocket maximum for your health coverage? Imagine your medical bills piling up and then suddenly stopping because you've hit a limit. That's what the out-of-pocket maximum is all about. It's a cap on how much you pay in a year for covered health services. Once you reach that limit, your insurance pays for everything else. This includes your deductibles, copayments, and coinsurance. But it does not include your monthly premiums, which are the payments you make just to keep your coverage active. For seniors managing their health plans, knowing this number helps plan for the worst. If you have a chronic condition or need frequent care, this limit can save you from huge expenses. In 2025, Medicare Advantage plans, which are private insurance options approved by Medicare, have a maximum out-of-pocket limit for in-network services of $9,350. Some plans might have lower limits, so it's good to check. If you go out of network, the limit can go up to $14,000. Once you hit this amount, you pay nothing for covered services for the rest of the year. Remember, this only applies to Part A and Part B services, like hospital stays and doctor visits. Prescription drugs under Part D have their own separate out-of-pocket limit. Starting in 2025, the out-of-pocket maximum for prescription drugs under Part D is set at $2,000. After paying this amount, you pay nothing for covered medications for the rest of the year. The Part D deductible can be up to $590 annually. This cap is a big help for seniors who take many medications. Medigap plans, which are supplemental insurance policies, sometimes include their own out-of-pocket maximums. For example, Medigap Plan K has a limit of $7,220, and Plan L has a limit of $3,610. Once you reach these limits, the plan covers all approved costs for the rest of the year. Original Medicare, which includes Parts A and B, does not have an out-of-pocket maximum. That means there's no limit on what you could pay in a year for hospital and medical services unless you have extra coverage like Medigap. What counts toward the out-of-pocket maximum? It includes your deductibles, copayments, and coinsurance. For example, if your deductible is $100 and your copayments total $200, and coinsurance adds another $300, your total is $600. Keep track of these costs so you know how close you are to the limit. For seniors, understanding these limits helps avoid surprises. If you have a Medicare Advantage plan or Medigap, review your plan details to know your maximum. Since Original Medicare does not have a cap, many seniors choose extra coverage to protect themselves from unlimited costs. The new $2,000 cap on prescription drug costs starting in 2025 is a big step toward better financial protection. In short, the out-of-pocket maximum varies depending on your Medicare coverage. Medicare Advantage and some Medigap plans have annual caps, while Original Medicare does not. Prescription drug costs have their own separate limit, offering extra peace of mind. Knowing these numbers helps you plan better and stay in control of your health expenses.